Hi everyone, so this is Charanjit. Today we are going to learn about the modifier 54, 55 and 56. So let's take a brief look and understand what it is. So 54, 55, 56 is known as split procedural modifier. So these are the split procedural modifiers. There are two things which we have to remember. These modifiers are not to be used in the ASC center, and if the patient is in the same facility after the transfer, then also we don't need to use this modifier. So we don't need to use these modifier in these two instances. So these two the tip which we have to remember while building the 54, 55 and 56 modifier. So 54, 55, 56 modifier represents when the preoperative, intraoperative and the postoperative. Usually these three services, intraoperative, preoperative and postoperative services, are given by the same provider only. But if it is given by the different providers, so different providers are ending the different components. One provider is giving the preoperative care only, like just evaluating the patient before the surgery and letting the doctor know that this patient is ready for the surgery, we can proceed with the surgery now. That is preoperative service. Next is intraoperative. Intraoperative means another doctor is going to do the surgery, and the postoperative means the different provider is going to take care of the patient or evaluating the patient after the surgery. So we don't need to use this modifier in the ASC center, because ASC center is an ambulatory surgical center. In that center, patient is coming to get a surgery only. So we are not going to use the modifier 54 in the ASC center, because everyone know that this patient is coming to get a surgical care only. And in that cases, if the surgery is provided in the ASC center, in that surgical package, pre-op and post-op is not included in the surgical package. So we have these three modifiers, 54, 55 and 56. 54 needs to be used when the surgical care only given to the patient. That means this intraoperative modifier is represent the actual procedure. So if the patient is coming to get the fracture reduction, then with the fracture reduction, let's say 26650, distal reduction of the radius and ulna, then we are going to use the 54 modifier with the procedure to represent that our doctor is just doing the reduction only. We are not going to follow up with the patient after the surgery. Then we have a modifier 55, which will represent post-operative management only. Post-operative management only means that our doctor is providing only the post-operative management to the patient, which is done after the surgery and related to the surgery. If it is not related to the surgery, then it will not going to consider it as a post-operative management. Then we have a pre-operative management. Pre-operative management means the doctor is evaluating the patient before the surgery and evaluating just to make sure that patient is ready for the surgery. That's it for these three modifiers. If you have any question, if you have any doubt, you can ask in the comment box. Do like and subscribe. Have a good day. Bye-bye.